Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University, and we're here in the L&B Levan Innovation Center. It's a combined effort between Nova Southeastern University and Broward County. And we have a very interesting program today. Let me introduce Jenni Frumer. She's a Ph.D. Oh, you got so many acronyms after your name. We're going to let you tell us what it is. And you're the director of the Morse Life Health System. So tell us what that is.
So I am a Ph.D. The Ms.Ed is for Master's in Education, and I'm also licensed clinical social worker. Morse Life is a health system that provides a variety of different services and service lines. They have a campus, which is here in West Palm Beach. I'm the Vice President of Strategic Initiatives. And on the campus, it's a full continuum of services from independent care to assisted living. They have an affordable assisted living that is connected to a PACE program, which is the program for all-inclusive care for the elderly, as well as memory care, short-term rehab, and some skilled care as well. And that's on the campus, and there are 800 residents on the campus at any one time. In addition, they have home and community-based services and serve an additional around 2,800 people in the community daily with a variety of services, including palliative care, home care, hospice care. I mentioned the PACE program, care management. I could go on and on. But the way to think about Morse Life Health System is that it's been in the community for 40 years and is one of the premier organizations that serves older adults and their families. We also serve hospice, as I mentioned, and also Holocaust survivors. So we have a unique understanding of intergenerational legacies of trauma, or transmission of trauma, as we call it. And so we're serving one of the more recent initiatives, other than AmeriCorps, is the Now for Holocaust Survivors initiative.
Well, that certainly is a very broad and important spectrum of services. Thank you. Let me now introduce Kathryn Powell. Kathryn, what does L.C.S.W. stand for? What's that acronym for?
Yes, so hello, my name is Kathryn Powell. I'm a licensed clinical social worker and the director of the Legacy Corps program. And our new program is designed to provide companionship and caregiver support services to maintain the independence of older adults in our community.
Okay. There's a very interesting thing, I guess, Ms. Frumer, the spectrum of your services are so large. I mean, the responsibility is really enormous. Usually, you find this split up into 4 or 5 different organizations. I congratulate the Morse Life Health System for bringing everything together, because I do believe, and you can offer your comment, that the collaborative association brings a more prominent and, shall we say, a quicker response to the needs of the public and the patients that you deal with. Is that true?
I would believe yes. It makes it more seamless. So it doesn't matter where someone enters, if you will, a system. They are able to get the services they need as their situation changes over time. As we know, older adults may need additional care over time. And so with everything sort of being under one roof, it's seamless as they go through a system that has the ability to respond, as you're suggesting, so quickly to their needs as they change. Oftentimes, I think adult children are leaving their parents up north, but here it's almost reverse. We have older adults who are leaving their families and their support systems up north to join maybe friends down here for a more resort type living. I joke that I'll never be hired by the Chamber of Commerce, because we've created, in terms of older adult communities, we've sometimes created these situations where cohorts are growing old together, and we've sort of removed those intergenerational families that can support older adults as they age. So I agree that we here in Florida, particularly here in Southern Florida, have some real challenges about the notions of how people age in place and how we can support them aging in place. That's how the Legacy Corps, AmeriCorps, really fills that need.
Kathryn, knowing that your Legacy Corps program at Morse Health, tell me the elements of your requirements and position as to how you fit into Morse Health.
Yeah, so it might be helpful for me to share a bit of an overview about our program and services within the Legacy Corps program. So as you mentioned before, we are a federally funded program and part of the National AmeriCorps project, which aims to provide caregiver support services around the country. And our program specifically will provide these services to clients living at Morse Life, but also around the community. And this is primarily accomplished through companionship services. We are developing this program to grant caregivers, whether they live in the client's home or across the country, a much needed break and stress relief, knowing that their loved ones are in good hands and are not as isolated or alone. So our goal is to provide respite service while maintaining and at times even increasing the level of independence in the assigned client. So we are currently recruiting and training volunteers to become Legacy Corps members of Morse Life, who will provide these services, which is primarily through socialization, and they can also additionally provide transportation to, it could be a doctor's appointment, grocery shopping, going to an activity of engagement, anything like that that could help to maintain the client's independence. So maybe this is an individual who is feeling alone and would like to socialize with someone in their home. It could be someone who needs transportation to a much needed doctor's appointment, or assistance with grocery shopping. Maybe they would like someone to be in the store with them and help pick out items. So in addition to the companionship and transportation services, they can also provide light cooking or housekeeping as needed. However, I should note that this is a socialization program primarily. So this isn't hands-on, no wheelchair transferring or medication administration, no heavy housework or heavy cooking, things like that. So it really is a wonderful opportunity for someone who is feeling isolated to get that support to manage their well-being. And in addition, if they do feel that they need additional support, they are connected to Morse Life to address other services and needs.
With reference to what Ms. Powell just said, Dr. Frumer, what is your affiliation with the medical and healthcare community? How do you derive their ability to provide services to the people at Morse Life?
Well, the first way is that Morse Life has the MAC Rehab Center. And so as older adults are coming out of hospitals and need rehab, we have a really state-of-the-art with the zero gravity equipment to help people literally get back on their feet again. And then from there, hopefully they're going to go back to their own homes with maybe some assistance to buttress their independence, or they may need a more, I would say, long-term care option. So we're working with the hospital's discharge planning, also hospice care. So Morse Life has hospice services and works closely with all of the healthcare settings as an individual may need those, including having teams as part of Morse Life's hospice program. And I would say the other way is through the PACE, the Program for All-Inclusive Care for the Elderly. is, it's also a state-funded program, PACE, and Morse Life becomes almost an insurance provider for those who are eligible for Medicaid and oversees all of their care, including their medical care. And so they may be residing in the community, they may be residing at a different assisted living in the community elsewhere. And the care coordinators, the PACE individual care coordinators, working with that client, working with that family, ensure that all of their medical cares are provided and monitored. One of the programs that I happen to have the greatest affinity for is their life enhancement program, which brings things like music and virtual reality and virtual travel to individuals who are isolated and not able to socialize as much. Again, that socialization theme is so important to us and sort of really fits in with the Legacy Corps piece, because it's really designed to enhance socialization for those isolated older adults.
Where are you located, by the way, physically located? Where is the program?
The program is out of the campus. Of course, not all our services are provided on the campus, but the campus itself is on Haverhill Drive, which is near the ballpark in West Palm Beach.
West Palm Beach. Okay, so.
And then we serve the whole of Palm Beach County, including out in the western communities in the Glades area.
Yeah, I was going to say you have the whole spectrum of individuals in Palm Beach County. Palm Beach County is much more divided relative to needs of care than some of the other counties which have been doing some of these things for many, many years. So that's why I asked, because it's necessary, particularly out to the west, where you have the agricultural interests that are still there, although much of it is now being developed into homes and whatever. But the bottom line is you still have the needs out there. The reason I'm so familiar with it is because one of the greatest healthcare heroes ever to come along in the state of Florida is Dr. Jim Howell. And Dr. Jim Howell, of course, lives in Palm Beach County. We stay in touch all the time, and I'm always aware of, through his communication, as to what goes on in Palm Beach County. And I was just wondering how broad a spectrum you are. And it would seem to me that you are. You're like a deck of cards. You just pull a card out, and I'm there. I'm out west. I'm in the middle. I'm in wherever. Is that true, Kathryn?
Yes, and I know on the topic of how things are funded and all that, because the Legacy Corps program is federally funded, it is a free service for those in need too, so that they are able to get the much needed companionship and respite care service, but also the transportation to appointments and help, a little bit of help around the house. So that is a great benefit of the program.
Yeah, well, I could tell you, that, again, without mentioning names, but, the bipartisan congresspeople that represent South Florida are very, very well aware of the programmatic needs and have been very, very supportive of funding. And I'm glad to know that you're there and you are funded. And I would hope that there would be more focus upon the needs of all of the citizenry of the state of Florida, because there's a lot of underserved areas in the state of Florida that are just, it's almost something to shed a tear about, because there are such needs for people who have given their lives, whether they were a physician or a policeman or a dean of a school or someone who was cleaning the hallways of the school. Everyone is a human being that needs help, and that's the wonderful thing about the Legacy Corp, is because it doesn't make a distinction relative to where you are, who you are, what you come from, but you have a need, correct?
Correct. And it's also extremely beneficial for the member. So we refer to the volunteers as members because there is a big commitment to joining the program, but it intrinsically is very beneficial to being able to socialize and give back and provide community service.
Well, we're down to the last sort of near the end of this very nice conversation. But Dr. Frumer, I'd like you to tell us how we, namely the public, other than making them aware of the Morse Life System and the wonderment of what you provide, what can we do to help you?
Oh, that's such a great loaded question. For people who live here in Palm Beach County, if they are interested in volunteering, we, for example, need volunteers to deliver meals to those who are homebound. We need people to help plate those meals. We're serving thousands of meals on a weekly basis. If someone wants to volunteer and become more involved, there's the AmeriCorps Legacy Corps program. I also would love for people to be an ambassador for Morse Life, to learn more about Morse Life. And you've done such a great job today, and we're so proud and pleased to be here, of giving us the opportunity of doing sort of a thumb sketch of what Morse Life is. But be an ambassador, learn more about Morse Life, be able to be in the community talking about Morse Life and how we may be able to help older adults who may need housing, may need to live out in the community with supports in order to maximize their independence and optimize living in community. So there, I think, many ways that people can get involved. Looking out for neighbors, and if they see a neighbor who may need help, is to make a referral. And we're working very closely with the Area Agency on Aging, with Alzheimer's Community Care, with the other organizations that exist in the community. So we'll never simply say we can't help you. We're usually going to be able to connect with all the other aging network services that are available in the community. And so we have a Morse Life website, which is really simple, morselife.org, and a phone number of where people could reach us at 866-761-2390.
Okay. I just thought of a question that came from a viewer, and but I think it was very important. In fact, we've done programs over and over again every year about animal assistance. Do you have an opportunity for people to live in the ALFs with animal dogs or cats?
Absolutely. We have a number of resident dogs and cats. And in fact, just recently over at the Independent Living, but it's on the campus, so open to anybody on the campus, we opened up our first dog park. So this is a fabulous place for pooches to go out and rest and play, and water fountain and the pretend hydrant, all in one place right on the campus.
Well, you're going to make a lot of the viewers happy to hear that, because we're I will say unashamedly, I'm a big proponent of making sure that the people with needs, whether they be elderly or young, it's been proven over and over and over again scientifically that the ability to have a pet is very, very helpful to the psyche, to the body. And Kathryn, I'm sure that you would know as a licensed social worker that that's true.
Correct. And as a pet owner, a dog owner.
Well, I'm a multiple dog owner, but I always, I don't purchase my dogs. I rescue them. So, but that's me, that's all. So, well, yes, we're down to the last couple of minutes of this show, so I'm going to let you start out, Kathryn, and do your public service ad. Tell us what you need and tell us what you want to do.
Absolutely. So we are currently recruiting both members and clients who feel that they would benefit from socialization and perhaps transportation. If you become a member of our program, you would again be providing this companionship, transportation, maybe some light help around the house. But we are seeking those with about 10 hours per week available to spend time with an assigned client that we take time to match you with. And if you reach 450 service hours in a year, you are then eligible for a $1,700 education award that you can transfer to a child or grandchild. And you can actually be in the program and earn this award for up to 4 years. So it's a wonderful opportunity to provide service to a client and the community, and also earn the education award to help out either yourself if you would like to use it, or a child or grandchild. So again, it's really a great opportunity. In addition to joining the program and giving back, there is a monthly stipend that you earn as becoming a Legacy Corps member, and you're reimbursed for mileage when you take the client out from their home. In addition to all of these wonderful opportunities, you get to join a cohort of like-minded individuals who are also passionate about helping older adults. And there's actually over 1 million alumni through AmeriCorps nationally. So you get to become part of something bigger and really connect with others. So again, it's a wonderful program to provide socialization and feel good about helping out your community.
Well, that's great, and we'll put up the telephone number and the address so that they can contact you. We'll have our producer and director find it out, and we'll put it up on the screen for you. And Dr. Frumer, you got your public service time. You got 1 minute.
As I said earlier, is the opportunity for people who may need help to contact Morse Life with its full array of services and multiple service lines to help older adults age with dignity and age with optimum care, as long as they're living in primarily Palm Beach County.
Well, I would hope that we someday see a situation where it isn't just Palm Beach County. So we'll see what happens. But I want to thank you both, not only for the hard work that you put into your program, but obviously for the advocacy that you speak of. Because in life, it isn't us, it's we. And we are all together when it really gets down to it. So I thank you, Dr. Jenni Frumer, and Kathleen Powell. We thank you very much. And I would hope that at some point in time we get to do this program again within the next 12 months if the good Lord says that I'll be here, which I'm sure He will. I'm not begging, I'm just asking. But I thank you both very, very much. It's been an enlightening half hour, and I'm sure the folks out there are going to be aware of what you do, how you do it, and the advocacy which you carry with it. So thank you both very much. Folks, remember, I always tell you, although in this case it may not always work, but I always tell you, don't hide your needs and particularly your medical needs from your physician or other individuals that would be able to help you. The only way that you can get help is by communicating. So don't keep it to yourself. A little pain sometimes is more than just a little pain. The fact that you maybe slipped and fell is not something that is just not noticed by the person that you're living with or the persons who are attending you. You've got to make the medical community aware of it, and they then could work with people like the people at the Morse Life program and people at Legacy Corps. So we thank you once again. This program is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see ya.